Imagine leaving a doctor's appointment feeling worse than when you arrived and knowing you're not alone. This is the stark reality for nearly half of the people in Wales struggling with their mental health, according to a recent report by Mind Cymru. But here's where it gets even more disheartening. Only 52% of individuals leave their GP appointments feeling hopeful for the future. That means a staggering 48% are left questioning whether the system is truly designed to help them. And this is the part most people miss. The systemic delays and lack of personalized care are pushing many to the brink, with some even turning to private healthcare as a last resort. Could this be the breaking point for the NHS in Wales? As someone who's been navigating this system for over a decade, I'm part of that 48%. My journey began at 13 when I was diagnosed with depression and later anxiety. Even then, I was told to wait up to 12 months for support from Child and Adolescent Mental Health Services, CMHS. As a teenager, I remember thinking, a year? That's an eternity. After finally seeing a counselor, I was met with another dead end. There's nothing more we can do. I was placed on yet another year-long waiting list for different therapies. It was a harsh lesson. Help would always be just out of reach. Over the past 11 years, I've tried countless treatments, none lasting more than 6 weeks. In 2022, after being hospitalized due to my mental health, I questioned whether my initial diagnosis as a teenager had been accurate. A doctor confirmed this was a real possibility, especially with adolescent diagnoses, and advised me to explore this with the NHS Primary Mental Health Support Service, PMHSS. But during my appointment, I was met with a response that left me reeling. If you don't know what condition you think you have, I can't diagnose you. It felt like the system was failing me all over again. Mind Cymru's research paints a grim picture. 36% of respondents in Wales feel their mental health needs aren't being met, and only half leave appointments with any sense of hope. Sue O'Leary, executive director at Mind Cymru, puts it bluntly: people are waiting too long or simply can't access the right support. This is destroying relationships, careers, and self-worth. She calls for an open access service with same-day referrals, a demand that feels both urgent and overdue. The Welsh Government responds with promises of progress, citing their 111 Press 2 service and a 10-year strategy for open access to mental health services. But for many, these words ring hollow. Here's the controversial part. While the NHS is a lifeline for countless individuals, its current state is driving those who can afford it to private healthcare. Is this the unintended consequence of a system stretched beyond its limits? What's your take? Is the Welsh Government doing enough, or is the mental health crisis in Wales spiraling out of control? Let's spark a conversation, because this isn't just about statistics, it's about lives hanging in the balance.